My colleagues, as I listen to the debate today, I hear a lot of subterfuge and distractions, but the fact is that this is a discussion about America's children, and it is a discussion about America. There is no industrialized country in the world that anyone respects that does not provide health insurance for its children. We are the exception, not a designation to be proud of. But the American people, in their wisdom, have this not as an issue, but as a value, as an ethic. And that is why I am so proud of what has transpired since we took our first vote on this bill. That day, I said we could establish ourselves as the Children's Congress, and we did. The work remains to be done to bring that to fruition. But in the meantime, across our country, Democrats and Republicans, governors and mayors, people who work with children or have the responsibility of delivering a system of health care have been advocating for this reauthorization of SCHIP that we have before us today. Every organization you can name, from AARP to YWCA and everything in between, the American Medical Association, the Catholic Hospital Association, Families USA, every organization you can name is supporting this legislation. I'm so proud because this week, earlier this week, Easter Seals representatives covered the Hill with hundreds of advocates visiting members' offices. We were pleased to hear from the president of Easter Seals, President James Williams, who said, without health care coverage, our early intervention and other programs for children cannot be successful. And that's why the Easter Seals organization was here. He was very eloquent in his advocacy, but no more eloquent than the young children who were here to tell us their stories. Today, the representatives of March of Dimes, I think over 400 of them, are visiting offices on Capitol Hill. And they have said, Dr. Jennifer House, president of the March of Dimes, has stated that SCHIP is the health insurance lifeline for millions of low-income children who have no other way to obtain coverage. Our country has put poor children first. That's called Medicaid. And the poorest of the poor children in our country are able to receive health care through Medicaid. I wish you could have heard the stories of some of the parents who told us, Bethany's parents who were in the other day. The press asked them if they were afraid if their family would come under attack because they were lobbying for SCHIP. I said we all are already under attack, but we are proud to come forward to support this initiative. We're not proud of the fact that we are low income, they said. We're trying very hard to lift ourselves up higher into the middle class. We work very hard not to be on Medicaid, but to be among the working poor. It's not something we brag about, but SCHIP is something that we need. So when the president wants to have 4 or 5 million children instead of 10 million children in this initiative, is he the one, the decider, who wants to go to that family and say, your child is out? Bethany had heart problems from birth. She was 2 years old in July. She has been told by some people as they lobbied, well, the baby's better now. You don't need SCHIP anymore. Well, she does. But they said, we're not just lobbying for Bethany. We're lobbying for all of the children. As far as the March of Dimes is concerned, as you know, the March of Dimes, I'm proudly wearing their pin, they deal with children with birth defects. And it might interest you to know that 1 in 8 children in America each year is born prematurely. around 500,000 babies prematurely. Many of those children, I'm not saying all, but many of those children have ongoing conditions that do not allay a precondition that bars them from getting any health insurance. Those children need SCHIP. They are in the category that makes them eligible. And that category does not include people earning $83,000 a year. So while some of you may use that as an excuse not to vote for the program, I hope you know intellectually that it is not a reason to vote against this initiative. There are currently no children enrolled in SCHIP with family income of 400% of the federal poverty level, $83,000 for a family of 4. In fact, 91.3% of the children enrolled in SCHIP are in families of 4 that make less than 200% of poverty. And 99.95%, just a hair under 100% of them, are in families under 300% of poverty. So this is a sad thing, because we're asking people who are working hard. They're playing by the rules. They're taking care of their families. They could have stayed out of work and stayed on Medicaid, but that's not what we're encouraging people to do in our country. We're encouraging them to move on and upward. And these families have to come forward and say why they have not attained the American dream of enough wealth to afford $1,200 a month in health insurance premiums. And that's a big order. I'm so pleased, though, that with the work that they have done, Easter Seals, Red Cross, and all the organizations I mentioned earlier, and the governors and mayors, etc., that now 82% of the American people support this initiative. If I said it before, I want to say it again. And let me also say that there are some myths about this. I don't really think they're myths. I think they're excuses not to vote for the bill. I mentioned one of them. Another one is about illegal aliens. Clearly, the bill states no federal funding for illegal aliens. It says it, but it is also the law of the land. Illegal aliens do not get benefits. So don't use that as an excuse to deprive 10 million children in our country who are eligible for enrollment in SCHIP, but they shouldn't get it. This has been a bipartisan effort. And some, again, of what has been said about this is simply not true. But don't take it from me. Senator Orrin Hatch, former chair of the Health Committee in the Senate, now the ranking member, said, "I believe that some have given the president bad advice on this matter because I believe that supporting this bipartisan compromise to provide health coverage to low-income children is the morally right thing to do. If we were truly compassionate, it seems to me we'd endorse this program." Senator Orrin Hatch, Republican of Utah. Senator Charles Grassley, former chair of the Finance Committee, another committee of jurisdiction, and now the ranking member, said, "The president's claims about SCHIP are flatly incorrect. The SCHIP bill is not a government takeover of health care. Screaming socialized medicine during a health care debate is like shouting fire in a crowded theater. It is intended to cause hysteria that diverts people from looking at the facts." End of quote. Senator Grassley, Republican of Iowa. And so, my colleagues, we have a decision today to override the president's veto, which would be, in my view, the right thing to do for our children and for our country. It's not about compassion. It's about fairness. It's about fairness. And this is a bill, again, that has been bipartisan in its development and required enormous sacrifice from the Democrats in the House of Representatives. We had a much higher goal. This is what is achievable for the children. It should have been signed by the President. There is no reason that he has given that is consistent with the facts. And so I urge my colleagues to think about the children, to think about Bethany, and think about a little boy, Derek, who was in my office this morning. He's the ambassador of the March of Dimes for 2007. He's 8 years old, born prematurely at 1.5 pounds, and now going out there and speaking on behalf of the needs of other children. The President is isolated in this. Don't join him in his isolation. Come forward on behalf of the children, and let's truly send a signal that we are about the future. I tried to do that when I was sworn in by being surrounded by children. It was a spontaneous moment, but it was one that was clear in its message. We are gaveling this House to order on behalf of the children. There is nothing more important than we have to do in our work than make sure that our children are healthy and safe. Today, we have an opportunity to do that. Let's not miss that opportunity. Let's give a vote for the children and against the President's veto. With that, Madam Speaker, I yield back the balance of my time. Thank you.
Gentleman yields back your time. Without objection, the previous question is ordered. The question is, will the House, on reconsideration, pass the bill, the objections of the President to the contrary notwithstanding? Under the Constitution, the vote must be by the yeas and nays. Members will record their votes by electronic device. This will be a 15-minute vote.